Dr. Gomez, we have talked a little bit about how tooth loss leads to bone loss, leads to looking ugly. Go ahead and tell us a little more about that, because I'm not so sure most of us patients are really getting that. And then when we do get it is when we look ugly and almost irreversible. Anyway, tell us about it.
Yeah, I understand that. Well, we recommend the patients that they need to clean the teeth properly, floss, to prevent any periodontal problem. Because periodontal problem will lead them to losing the teeth. And once you lose the teeth, then you're gonna lose a lot of bone, and your face is gonna shrink. The bone is gonna shrink, and the muscles is gonna collapse, and you're gonna look very old. Sometimes patients, we ask the age, and then when you see their face, they look pretty old compared to the age that they say they have. So it's very important for the patient.
Well, how much? Well, what are we talking about here? I mean, is it a small little ringlet? Do people look, okay, you look at maybe a year older, or is it like significant, 5, 10 years older? What are we talking about?
No, it's about 10 years different.
Wow.
So sometimes.
Have you physically seen patients who look that much older because of it? Have you really seen that happening?
Yeah, I have seen so many patients that they look very, very old because they're missing teeth, or because they were in dentures. And dentures are going to make you look very, very old. So if you want to prevent that from happening, you have to really take care of your teeth. A lot of patients can change the way they look just by fixing the teeth. If you get an old patient and you replace the teeth, you might put implants in there and replace the supporting structures of the facial muscles, that patient is going to look more and more younger.
Wow. So if a person has already shrunken gums and a caved-in face because he were wearing denture or maybe kind of nothing, is there still hope to improve it, or once it is happening, it happened? Tell us a little bit about that.
Not really. Once it happened, you can improve it. There's always a way of improving the appearance of a person. And by replacing not fitting dentures, replacing the bone that have been lost, maybe with implants, instead of wearing something, dentures, maybe changing the dentures for something fixed. It depends on the patient, but actually we can really change the whole looking of a person that is have missing teeth for a long time. And they can
Wonderful.
Look more younger.
Yeah, wonderful. So obviously, first making sure we don't lose teeth, which is by brushing, flossing, and by going to a dentist to do the regular cleanings and maybe deep surgery anyway. To do that work is the best thing. But once you do lose it, make sure you give the bone the feeling of having another tooth in it via an implant, so that the bones don't shrink, because otherwise you just add on to the procedure, to the bill, and years of bad looking. Thanks a lot, Dr. Gomez.
You're very welcome.